Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County.
The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
ये bet में आया.
我们能够做到.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Today we are pleased to be joined by Mendocino County Health Officer Dr. Andy Coren, who will give us an update about the COVID-19 status of our county. After that, we'll open up to take a few questions from the media concerning the current surge of the COVID-19 in our community. Now, beginning with the health update, Dr. Coren, you have our attention.
Thank you. So we're seeing fires to the east and terrible drought in the western part of our county. And the surge I spoke of last week has worsened dramatically. Kirk, can we have the first slide of the epidemiologic graph? Last week, I reported the case increases from April low of 2 cases per day to July 31st at 21.4 per 100,000 cases per day. Last week, we ended with 38 cases per day. Oh, I'm not seeing, well, maybe I'm just covering it up with something. No, that's good. So last week we saw it ended with 38 cases per day. And for this week, just to let you know, yesterday we had 95 new cases, which is the highest single day report we've had since the pandemic began. And I'm projecting that the average daily case rate this week will be in the mid-50s. Northern California as a whole has had the worst case rates in the state. And now with there's a surge in Humboldt, Del Norte, and Lake County that's actually worse than ours. And Kirk, could you put up the next slide? That'll demonstrate that. So you can see the green is Lake County, they're way up here. Humboldt County is in the middle. And let's see if I can see it. I think we are the next. Oh no, I think that may be Del Norte. I'm having trouble with. Here we go. Red is Mendocino. That's right. We don't have Del Norte on here. Sonoma County is down here, and the composite for California is here. So we've gotten to be a lot more having a lot more infections, and the case rates that we're reporting here may be actually higher because there's less testing, but they also may be less than the total numbers that we're getting because of less testing. In other words, it's a little less reliable. However, when we look at hospitalizations, when a certain percentage of people get sick, they're going to go to the hospital, and that's not hidden by so much data parsing through different platforms. And so we can estimate a certain number of all cases will reliably wind up in the hospital. And in the past, we've had, I'll quote again, in July, our hospitalizations ranged around 11. Yesterday, we counted 22 cases from Mendocino County residents in all the hospitals. 8 were in the ICU, plus an additional 2 came in from Humboldt, which I don't think is on this slide. But you can see the hospitalization numbers are in red, and this is higher than it was in December, January, February. These numbers in blue are in the ICU, and you see one peak that's up here, but you can see that they're clearly climbing, and they're again higher than they were in the winter surge. So we have definitely got a surge that is, we don't see the end to that. We have also suffered our 54th death in the last week, and we are all mourning that death. There have been no outbreaks, but we see more community spread. As I said, retail and restaurant workers frequently will come in, not even thinking that they have symptoms, and some of them have mild symptoms they don't think could be COVID, but they spread it around. Last year, the soaring number of cases and hospitalizations fell very quickly because of vaccines, but many have hesitated to get their vaccines or resisted and this is a very safe and effective step. Over 95% of hospitalized people are unvaccinated, and these people are putting themselves at risk, are now filling our ambulances, hospitals, and ICUs. All of us may soon have trouble with access to intensive care unit or medical care. And that this is also consistent with the state numbers of unvaccinated at a rate of who get hospitalized at a rate of 12 times those who are vaccinated. 88% of cases in Mendocino County are unvaccinated. Again, the state estimates that the unvaccinated account for 7 times the cases of the vaccinated. So the vaccines are our major protection. They are effective to keep us from severe disease, hospitalization, and death. These are also numbers that are coming up. Are they safe? You tell me. Every major medical, nursing, hospital, and healthcare organization is now recommending vaccines for the old and for the young and for women who are or want to become pregnant. This is the way to protect ourselves safely from the COVID. So for those who have not been vaccinated, please take the shot for you, for your family, and for the community. The Delta variant is very different. It's more contagious and more virulent, more severe diseases. We're seeing it in younger people in the hospital, reflecting their lower vaccine uptake, especially in the 18 to 49, but also on up to the 65-year-olds who should be getting vaccinated. We're also seeing some more children with symptoms now, and nationwide they're reporting more children in hospitals, and there have been several hundred who've passed away as a result of COVID. Post-vaccine positive tests have increased, but remember, this is due to the fact that we have such a higher number of vaccinated people. So the vaccines are not 100% effective, nothing is, but the efficacy still is in the 85 to 95% range. We're not seeing evidence of waning efficacy among the majority of people. However, this virus is contagious enough that we see post-vaccinated people able to spread the disease, and that is new. So again, another group that we're concerned about, even after they're vaccinated, is elderly and others with immune system issues who continue to be somewhat more susceptible after full vaccination. And so these people should be wearing masks, even double masks, and avoiding mixing indoors or outside. And their families and others in their household should also take a little extra caution that they don't bring the COVID home to those vulnerable people. Last night, the FDA, as I'm sure many of you have read, gave approval for boosters of the mRNA vaccines to people who are severely immune compromised, and used as an example those with organ transplants that may extend to others who are on cancer therapies or even rheumatological therapies. But this number of people is less than 3% of all of the United States adults, according to the CDC, and that doesn't come near the numbers of people we need to get vaccinated to get more to a community immunity. There'll be a panel of CDC advisors, I think, meeting today to discuss how to roll this out. For example, who will actually qualify, how to verify, and who should make those decisions, administer those vaccines. And even in this group, the efficacy seems to drop from 95% to 84% in one study. The next slide shows vaccinations in Mendocino County. We're proceeding at a slowly increasing rate, but it is increasing lately. And you can see that here. The blue line is our numbers, and the gray line is the states. We're very close to the state in this slide. As of August 9th, we had distributed 94,919 doses. That involved 62.1% of those who are eligible were fully vaccinated. 54.3% of the total population are fully vaccinated. And this is important because they're talking about to get to community immunity or herd immunity with the increased transmissibility of the virus. They've talked in the past about 70% of the population being fully vaccinated. We're now talking in the range of 85 to 90% of the population being fully vaccinated. Of those people who are eligible for vaccination over 12 years old, 72% of Mendocino people have had at least one dose. From an equity perspective, we exceed the state among Hispanic population and in the lowest resourced population, as well as those between 50 and 64 years old. It's still not enough. People are now seeing how safe and effective vaccines are, and more are beginning to get in line to be vaccinated. So with this surge occurring, what have been the responses? And I'll just review these briefly. On July 26th, the CDPH mandated all employees in acute and long-term facilities, clinics, and congregate care settings must wear medical grade masks. And we also released orders last week for mandatory masking indoors in public places. And I've been recommending elderly and those with immune compromising conditions mask outdoors or double mask, especially in crowded areas. And I've been working with some of the venue operators for outdoor events, such as the concerts in the park, to voluntarily increase education and encourage more physical distancing. On August 5th, the CDPH released new orders to mandate that all healthcare workers must now show proof of their vaccination by September 30th. And there will be some narrow exemptions for religious belief or written medical exemptions, and then regular testing will be needed for them. Adventist Health here in Mendocino County, but I think system-wide, is now implementing this as a new policy, and we look forward to others in the healthcare field, but also in other fields to implement this type of a policy. Next week, we're releasing orders for our fire, EMTs, and first responder organizations to require verification of vaccination of their employees or to regularly test those people who qualify for a narrow list of exemptions. And that will be effective on September 30th. We met with those groups and got a very supportive response. The state, in order to protect our schools and keep them safe to open, in addition to universal masking, has now mandated vaccine verification or regular testing for all school staff who qualify for an exemption. Note that while the school children generally get less ill, there is an increase in the country of symptomatic children, and we're seeing that here as well. The county will soon release guidance strongly recommending that all employers, including government agencies in Mendocino County, develop and implement policies, human resource policies, to require vaccine verification or frequent testing for employees who are exempt. Our county HR is already working on these new policies, and we're hoping that the other governmental agencies and other businesses and employees will follow. But also, we have on the agenda to release the guidance for all employers to adopt a vaccine verification or for exempt employees, a testing program. Because we've been so inundated with more cases in the last couple of weeks, we've sought state assistance through their response testing team, like a strike team, and we're requesting an increase in our OptumServe testing, which goes around the county, because we know and we've heard that we need more testing. Our testing numbers have gone up 300% in some areas. So the advice that we want everybody to understand, again, because our contact investigation, contact tracing team is very stretched, is that we're getting help from the state, as well as calling on volunteers from the community and reassigning county workers to help. But if you have symptoms, stay home and get a test. Vaccinated or not vaccinated, if you have symptoms, please get a test. If you test positive, you need to isolate, and then cooperate with our contact investigators team for advice, and also to protect the community, and also to help offer assistance with food or housing that you may need in order to maintain your isolation. If you know you've had a close contact within 6 feet of a person who's tested positive for over 15 minutes during an entire day, test and quarantine if unvaccinated. If fully vaccinated and you're a close contact, you do not need to quarantine, but should be very careful around elders and immune compromised people, mask and distance, and test at 3 to 5 days to see if you've become infected, in which case you would be formally isolated and in order to protect others at work and in the household. Remember that the non-pharmacological protections for this respiratory disease are still effective. Masking indoors in public places and outdoors in crowds, except while eating or drinking. And when you're not eating or drinking and just ordering, please keep your masks on to protect the people who are working there as well as others who are eating there. Ventilation, which is provided by being outdoors or opening windows indoors or even using fans indoors, but with the fans pointed out the window so we can pull the air more gently in to the room. And if you use air conditioners, don't recirculate the air because we want more air to dilute those COVID particles. Keep your distances. That is still good guidance. And as far as gatherings, we don't have orders about that at this point. It's individual choice, but we want to avoid large gatherings. Outdoor is safer. Avoid eating. Keep the gatherings short, and try and maintain your distances. And always remember the hand hygiene and respiratory hygiene. So in summary, COVID Delta surge is here. It's increased cases tremendously in Mendocino County. Our hospitals staffing is being stretched and stressed. Please get vaccinated. They're safe and effective. Now is the time. If you have symptoms, stay home, get tested, follow isolation or appropriate quarantine recommendations, and cooperate with our contact investigation team. We can survive this together without closing down the economy is the hope, without shutting down recreation or schools. But we need the cooperation of everyone in our community to take very personal to protect themselves and protect the people around them and protect the community with the lessons we learned last year. And I believe this can be done. And with that, I'll stop my presentation and be here for any questions.
Thank you, Dr. Coren. First up from the media, we're going to have Alicia.
Hey there, can you hear me?
Yes.
All right, thank you very much. This is Alicia Bales from KZYX. My first question, you said there are 22 cases in the hospital with 8 in the ICU. That's incredibly concerning. That's more cases than I think we've seen so far during the entirety of the pandemic. How are our hospitals doing, and do they have and are they activating emergency surge capacity plans?
Yeah, the hospital staff is very stretched. Some of these, we have 3 of our community people in hospitals, 4 who are actually out in other community hospitals or in other hospitals at UCSF, Kentfield, Sutter, Sacramento, and so forth. But there's no question that it is stretching our hospital staff to the limits. We have not gotten so many in the ICU that we've gotten less than, we're now around 25% of our ICU capacity. And if you remember the stay-at-home orders of last winter, the critical range was 15% or less. And the CDPH is releasing some new advice. They've just given me a draft regarding hospital transfers and so on. But it's not only the numbers of cases we have, but the exhaustion of the staff. It's very hard for them to find replacement staff. The state used to have a list that we could call on and ask, and there'd be available. That number has dried up quite a bit. We're using registries more. The Adventist system has a large system. They can draw people from one part of the state back to another part of the state if it's necessary and available. But it is a crisis situation at this point.
All right. I mean, I guess the only silver lining there is that healthcare workers aren't as at risk of severe illness and death if they're vaccinated, which they were before. So my other question is, I know that over the last 2 weeks, we've had 4 additional deaths from coronavirus in our community. And I wonder, with the new approval of booster shots of the coronavirus vaccine, if 2 of the people who died in our community were fully vaccinated, and I wonder if these folks would have been candidates for those booster shots, and if that would have made or could have made a difference in their outcome.
Yeah, I don't know about the specific cases. I'm not their physician, and I don't want to speculate about that. But it may have been. There were other issues, and frequently are, in people who are vaccinated and get sick enough to be in the hospital. So there are other what we call comorbidities. But yes, if the CDC feels that we should be doing both booster shots for some immune compromised people, will go ahead and do it. The data is pretty thin. The demand is great, and I'm not sure how beneficial it will be. But it looks like it will be from the point of view of looking at immunoglobulins, but that's not the only immune factor that goes into the totality of immunity. So there's some debate, but I think if the FDA is going forward with it and they'll come out with clarity about who should be get boosters and who should not, we will definitely, push that in our community.
All right, and people will be able to get boosters from their own physicians or from county vaccine events?
So how it'll be rolled out is still a question, because certainly for the immune compromised person, that requires some knowledge of their medical chart, and probably it will be their provider who says this person has these conditions. Doesn't even have to. Usually, we don't require them to outline the conditions that they have, because that's personally protected health information. So how that will work, I can't say at this point.
All right. Thank you.
Thank you, Alicia. Next up will be Danila.
Hello. Thank you for having this meeting. And I really appreciate the fact that we got to ask a lot of questions last time. That was very beneficial to the community and a lot of positive feedback. So my question today is again on schools. I know we talked about this before, but now we're seeing this surge that we've never seen before. Also, you've stated that this Delta variant, I believe, is infecting children more than it had before. We're seeing those numbers on the chart. You had said previously that there was no cases, Mendocino County, that were children hospitalized, but you are seeing that across the United States and some even deaths. I know that the president, California governor, CDPH, and you as a health officer want to see children in school, and that there was funds allocated to make it safer. Seeing that there are vaccines for staff, but there are not vaccines for 12 and under. What changes are being made that you can assure that we are safer today with this current surge than we were last year when we went to distant learning?
That's a good question. Last year we went to distance learning. There were no vaccines around, and a lot of the teachers were not vaccinated until the pandemic surge started to decrease in March and April. We now have the teachers, the vast majority of them are, and staff, I should add, the vast majority of them are vaccinated, and pretty soon all of them will have to show proof of vaccination, or they'll be tested on a very regular basis. We're also instituting universal masking and testing. That will be screening testing, not only for the teachers, but also in certain situations for the children. And we think that all in all, those interventions should protect our students and their families and the community from any unusual spread. While we've had some more children who've tested positive for COVID, none of them have been severely ill. None of them have required hospitalization here or being sent out of the county for hospitalization. So I think the key is to keep them protected with the adults around them being vaccinated and using masks and those kinds of things within the school. The other thing that we're going to be doing within the schools to try and keep them open is not to necessarily send every close contact home. If we know that everybody or the people who were in contact with a positive case, if that happened within a school where it was supervised and both parties were wearing masks, then it will be okay to keep the close contact in school, testing regularly with the mask on, and we'll of course watch for any symptoms. And if they seem like they are infected, they won't be back in school. But I think we have mitigation efforts that should help, and we'll just have to see. The Delta variant clearly is much more contagious. Luckily, we have not seen hospitalizations growing here in Mendocino County for children, and so I think we're better protected at this point.
Thank you for answering that. We had a lot of people, like 50% were members asking that question. So my other question is, a lot of people, and I know that Kirk Ford had mentioned this as a possibility on the graph, there's some empty space there, maybe where we had the colored tiered system before, but a lot of people for months now would like to see the numbers that you are giving on the case positive and the hospitalizations show if vaccinated or not. They would really like to see that number displayed for whatever reason they find that valid, and just want to know if that's an option to add to the graph.
We'll take that back. The number of people who are vaccinated and wind up hospitalized is too small to actually appear on the graph, probably. But we can look at how it should appear and how we can present that on a graph in the future. So that's a good suggestion.
Yeah, just as a little bit of background, there's a couple of spaces on that daily stat tracker where we had like percent of positives testing. And then when we stopped reporting on that because we're using the state for testing data, that just kind of going to waste. And so I want to put some data there, but we don't have a lot of room to put like a full graph, but maybe a couple of data points. If we're seeing a lot of viewers or readers wanting certain data and we happen to have that data, we could potentially put it there. So that was one of the things that it might be good to hear from all the outlets to get an idea of what your readers or what your listeners or watchers want to see. And then if we have that data, we can put that on the stat tracker going forward. That was kind of my intention with that.
Yeah, even that number that you guys keep mentioning over and over that changes sometimes weekly, the 88%, the 99%, something even like that would be helpful. Thank you.
Thank you.
Thank you, Danoa. Next up is going to be Matt.
Hey guys, thanks for hosting today. Doc, my first question, I've just been thinking about our place in history at the moment. We're in the aftermath of one of the most significant global vaccination efforts. We're in the summer, vitamin D levels are high. Our social gatherings are more likely outside than inside. Why is this surge happening now? And how is this surge more significant than last winter's when some of those elements weren't there? I'd love your thoughts.
Well, the Delta variant is far more contagious. That's the biggest confounding factor here. It's really very different than what we were dealing with last year. Another thing is I'm not quite so sure that even though it's summer, everyone is outside, because the summer is so hot, many people are running indoors to air conditioning. And so that may contribute also to the high rates. I think that people are vaccinated who definitely wanted to get vaccinated, but there's almost half of the population, there's 40% of the population who are not vaccinated. And they are the ones who are so vulnerable to the variant. It's just whipping through that community. And it's, not only creating cases that we don't know about, because a lot of those people are not testing either, but it's being spread about by the people who are unvaccinated. And so it's this sort of infection that's going on underneath that we really can't tell until we do get someone who tests and gets positive, or they wind up in the hospital. So the answer to your question, I think, is the contagiousness of this Delta variant is huge. What they're saying from the biologic immunologic side is that the decrease in efficacy of the vaccines is not that significant, but the estimates of the variant's contagiousness are enough to produce this kind of a problem.
Thanks for that, Doc. And you sort of nudged up against my following question, and it has to do with the Delta variant's ability or inability, perception, and anxieties associated with the Delta being able to, that phrase, breakthrough, post-infection, positivity. I've read a lot of anxieties associated with that. The suggestion of the booster shots. Maybe you could just speak to Mendocino County residents about those concerns, this idea that this vaccine won't protect me. I'd love to know your thoughts.
Oh, good point. Well, we know that nothing is 100% effective. Anything, anywhere in medicine or anywhere else, nothing's 100%. So from right out of the gate, these vaccines were said to be 95% effective, which is far more effective than any other vaccine I've ever seen. So that's huge. The numbers of people who are having the infection still remain much lower than the 5% you would expect of those people who've been vaccinated. So for example, in our county, let me see, I just did a rough calculation, and it was 0.3% of fully vaccinated people who are positive. And so it should be 5%. It's less than a tenth of that. So the vaccine efficacy is extremely good, and it's even better for those people who, to keep people out of the hospital or severely ill. Is the vaccine efficacy decreasing? No, it's the 5% is now 5% of a much greater number of people who are vaccinated. And so that's why we see the numbers of people who have COVID after the vaccination have gone up. And that's an important concept to understand. What the CDC, well, let me put it this way. As far as boosters go, it's not just the numbers or the amount of immune globulins. There are at least 3 different types of cells and cellular immunity that go into creating immunity itself. We use the immune globulins count as kind of a surrogate to tell us, what we think the immunity is, or the immunogenicity of the vaccine is, but it's not the total picture. So when they see some of that go down over time, some may say, well, that means that our immunity is decreasing, or the vaccine efficacy is decreasing. I'm not so sure that that's the case. You get a lot more immunity from the vaccine than you do from the illness. So that's an important concept also to understand. So the reason for the recommendation for boosters that's coming out of this FDA in the last 24 hours is actually really dependent on some very few studies. And it's unclear to me that the result of giving the boosters is significantly better, because the studies are so small. And whenever we see studies that are small and singular, there's always the possibility that they were misleading for random reasons. I won't get into them, but there's a lot of reasons things are repeated before we set to them. We set our sights on them. The other thing is, I'm not so sure that a booster will necessarily give increased immunity to those people who have problems with their immune system. So it's not a panacea to give the same vaccine a 3rd dose and that will be much more protective. We don't know that that's the case. What would be good is if we had a vaccine, which is in development, that would be as effective as the other ones were, but specifically for Delta. And they're looking for other ways to attack these viruses that may be more effective for the Delta and for other variants that come along. So there's questions about whether the boosters are going to be adequate. But the issue now is that the vaccine is very, very, very effective, even against the Delta variant. It's extremely effective at keeping people out of the hospital, keeping people from getting severely ill, and keeping the death rate at a minimum.
Thank you, Doc.
Okay.
Thank you, Matt. Next up will be Juan.
Oops, I guess someone was muted. Must have been me. Hi, Dr. Coren.
Hi.
Juan Orozco here covering for Jackie Orozco of El Punto Paper. Just a couple of things. Well, actually, one because another of my points here was a suggestion that Mila made. Just so that you have a second a suggestion here on adding those numbers that Danila spoke about, and maybe if we're not adding, if we consider, like you said, that the numbers would be so small for those that are hospitalized, maybe just the ones that are vaccinated and got infected. It would be good. You got another sector of our community that is asking for those numbers as well. And the question is, we have plans to have public events, open space public events. Are we considering having to cancel those at this point? Just if there's any conversations around having to cancel any open space public events.
So there haven't been discussions yet to do that by mandate or by order. I think that, as I was saying before, I'm talking with venue operators to voluntarily, emphasize the importance of protecting ourselves individually, maintaining the space if we can, the distance between people, making sure people are masked if they're immune compromised, or if they live with somebody who's immune compromised. That's good. And I would recommend, with the case rates as high as they are, if I were to go to one of these events, I would wear my mask. And I think what we're trying to do is really, we've used the last year and as a learning and preparation for what we have to go through now. It would have been nice if it was wiped out, but that's just not what nature dealt us. And so I think individuals and groups have to protect themselves. When it comes to gatherings, we want to, again, go back to the lessons we learned. Keep them small, keep them short, keep them outside, minimize the eating and drinking, because that's a very important time when transmission occurs. Music and singing are higher risk activities. If people are singing like a choir or something, have significant amount of distance between those people and the next people, and the audience. At least 12 feet, maybe 20 feet. If they're on a stage, it should be more. There are masks for wind instruments that actually decrease the spread of germs from them. So, we don't want to unnecessarily impose restrictions on the community, but we do want to encourage people to protect themselves and use the lessons that they learned in the last year.
Yeah, I realize that public events is also a good thing to keep sanity from all this going on. To be entertained for a little bit. And another advantage of having these events is that a lot of people get together and can possibly get vaccinated or get tested. And so I know the city of Ukiah is using that advantage of having that many people so they can get tested. And that's our plan, to continue doing that if possible. Thank you, Dr. Coren.
That's great. Thank you.
Thank you, Juan. Next up is going to be Kate.
Hi, thanks for having this. I wanted to first speak just briefly to the question about providing additional data. I think that was a conversation that started in some comments on one of our articles. And I want to share my support for the county providing any additional breakdowns of vaccinated versus not vaccinated data that is available. It is one of the top questions that we get with any kind of COVID coverage. There was a moment in time where the county was providing on the county website, not in the actual little data graphic cards, but a breakdown of positive cases by zip code on a daily basis. And I know that's something else that often comes up just because those county areas are pretty broad, North County versus coast or North and South Coast. And so I guess just from our perspective, any additional data that you could provide more regularly would be great because it just helps provide more transparency and clarity for our readers. And we do get a range of those questions. And certainly if they can't fit on the card, we're happy to go to the website and look that up if that's easier. So,
thank you. So
and thanks so much to Kirk for noticing and for asking the question and offering that as something we could discuss, because it is great to be able to answer people's questions in between these meetings. And I think just having more numbers is really helpful for people to get their heads around the scope of what's going on. So in terms of my first question is sort of about how the county is rescaling up in response to this recent surge. I know that there has been an increase in people seeking vaccines, and there's also been a really significant increase in people seeking tests. And Dr. Coren, you mentioned that there's been a request for state assistance to increase OptumServe capacity, both, I don't know if that's also at Ukiah, but around the county. But my question in part about that is specific to testing. I would anticipate that the number of tests would only be increasing as these new policies are being implemented, as healthcare workers and education workers and county workers and potentially, people at businesses are getting tested more regularly in response to these new policies and are using the free OptumServe testing as the way to do that. If there are plans to kind of ramp up that capacity even more so to address the anticipated increases. And also if the county's doing similar things around some of those other programs. I know, back in December, we did have hotels for people to quarantine at. We had bigger hours or longer hours at the county call center. We had longer hours at the testing places. We had more food programs. A lot of those things were ramped down in June. And so I don't know if we're, reapproaching comparable levels to last winter or how the county's thinking about that response across the board.
Great questions, Kate. Thank you. So one of the first ways that it has affected us from the county point of view is our contact investigator and contact tracing team. And when we were down, you can imagine at 2, 4, 10 cases a day, the people in our department who were assigned to that were able to handle it, and it was not a big deal. We still had some contact investigators from the state, so our own people could cover the full weekends, and they continue to do so. But it has become really burdensome during the week because the state workers have been withdrawn, and it's been pretty much going it alone for the county. Not alone, but we've had much less availability of state workers. So we have put in the request, and we are getting some uptake from the state to provide trained contact investigator and tracers. So our people, we're one of the only counties in California that continues to make an effort to contact every single person who we get a positive test from. Most of the others have just given up. They can't do it. And we're doing it, and we're creating these statistics because we found that sometimes the state statistics are not, there are problems that happen with platforms and so on and so forth. And we've been ahead of the ball in some of recognizing some of these trends because we continue to do it internally. But we can't do it all internally. So the state is being requested to ramp up their help for us. And they've actually have rules that the people they had available had to have I think it's a 3-month break. And so we lost a lot of state disaster volunteers for that. But we're trying to get a contract with an organization that they have pointed us to and is contracted with them. But I think it's going to cost us to get the more contact investigator and tracers from them. We are, however, reaching out to the volunteers in the community, and hopefully they will step back up when they see the dire situation we're in. And we're also utilizing people from the entire county government who have graciously given their time and exhausted themselves while still, in many cases, having to keep up the other work in their public health assignments or other assignments in other departments around the county government. We also have requested from the state CDPH one of the resources they've kept is what we used to call strike teams. They're now called response teams. And I think we have one beginning next week. And we are starting to open the negotiations with OptumServe to increase their resources for us. As you know, we have what they call a brick and mortar site at the Ukiah Fairgrounds. And we also have a traveling team that has a regular site in Fort Bragg at the VA Hall. And we have the traveling team also goes around to 2 of the smaller towns or cities in the county each day on Fridays and rotates around the county. Some of the cities have had it twice a month, others once a month. We hope to increase that and get another traveling team so that we'll have much better coverage. We do them in half-day segments because we have smaller population areas, and so we exhaust the demand in a half a day. And so in order to keep up the total numbers that we need to do by contract, we rotate them around the county. So we're going to have to get back into replanning how to do that. So our testing resources match the demand. And the demand has gone up. It's great. We still have reserves, but we're getting close to limiting them or to exceeding them. And so people have asked us and we're reaching out. We see it as an urgent situation with the cases going up. As far as vaccination goes, now the clinics and hospitals are really taking on the vaccinations in a much greater way than they were able to do in the early part of the year. And in addition, we have the pharmacies around the county who are doing really a very good job in dispensing vaccines, and we hope that they'll continue. And the county has ordered an increased number of vaccines so we can support those efforts. And we'll also be having our own continued vaccine events. And we're gearing up along with the schools to begin to have vaccine events actually at the schools, if that's possible. And certainly with the younger kids, when they become eligible, the 5 to 12-year-olds, we'd like to be able to do them at the schools, which will be familiar to them and less threatening. So those are some of the ways that we're addressing. Oh, and then you had asked about other resources for housing and food, and we're continuing or re-signing those contracts at this point. Anne, did you have anything that you wanted to add to that?
Yes, I was just going to address the food. Even though the Great Plates program has ended, we are still providing food to those people who need our help being isolated. So let's say you've had a close contact and you either test positive or you need to quarantine because you might have tested positive. Then you just don't have any place else to stay. Let's say there's, a 2-bedroom, but 5 people living in it, and it's really not safe for you to go back. Then we put you in a very budget hotel, and we provide food because we don't want you going out to get your own food. That won't be helpful at all. So right now, for example, in the county, we have 8 different people housed And if you're interested, by the way, in volunteering for that program to deliver meals outside the door or to help with contact tracing, NCO is North Coast Opportunities is the place to volunteer. And that is ncoinc.org, ncoinc.org. Thank you.
Thank you.
Thanks so much for clarifying that, Dr. Coren and Ann. And I anticipate that there will be, just given with the changing policies, a pretty even further increase in testing. So I'm looking forward to hearing about the county plans to do that in different parts of the county as they develop. My second question is just sort of, given that we've reached a level of cases in the North Coast of Northern California area that is, significantly higher than our previous peaks and significantly higher than what had occurred during the winter lockdown. Is there any discussion either within the county or within the region or statewide about possible metrics or decision-making points that might be used? We no longer have the tiers, we no longer have those little regional ICU percentages that we had at some point. Is there any consideration of making and implementing any kind of further restrictions or enforcements? And if so, what would the measures potentially be to make those assessments, and who might be having those conversations, or is that sort of in the mix at all?
Yeah, well, the state is definitely looking at that. And the first asset that we must protect is the hospitals and ICU. So they're developing the metrics for that. And they just sent out a memo that they're doing that. I don't know, exactly what they're going to be looking at. I'm sure that they're going to be looking at ICU capacity as well as hospital capacity. And I think that one of the things they're going to be making sure that we do, I surmise from the memo, is making sure that if we need to transfer someone, then another place in Northern California or in the state that has the room will be required, as they always do, but will definitely be required to admit, and vice versa. We need to be be good neighbors to the counties that may be suffering more than we are at a particular time, and hospitalize their patients. And that's going on right now. We've hospitalized people from Humboldt now and Lake in the past. And we're, of course, hospitalizing some of our sickest people in the intensive care units to the south of us, San Francisco, Sacramento, Santa Rosa. So that's the first focus that we're taking at this point. To come up the blueprint, I think that'll take a little while to see how bad the surge is statewide. And if it's sustained, then it will take a response, it probably will take a response, something like that.
Okay, thanks so much. If we could keep getting updates on those broader conversations as they develop, that would be great. And if I could just say one more thing quickly about the data question. I know that Alameda County has been releasing their vaccinated, unvaccinated breakdowns as of recently, and so they might have a graphic example that's easy to use in terms of that. But if the county is planning to track data around how many county employees and emergency responders, just even on a percentage level, are vaccinated or not, as these new policies are being implemented, it would be really great to get some data around, say just 60% of county employees are vaccinated, 40% are now being regularly tested, or anything like that that is available. Thanks so much.
Great suggestions, Kate. Thank you.
Thank you, Kate. We're going to go through one more round of questions with everybody. We have about 6 minutes left, so maybe one question per outlet, and then we'll go through the list. So first up is going to be Alicia.
Okay, great. So I'm just curious if you can give us a snapshot of how vaccination rates in the county are doing. Are they increasing in response to the Delta variant and your urgent and constant requests for people to go ahead and get this vaccine?
Yeah, Alicia, they are going up. Do we have that slide handy? Kurt, we have a nice slide that shows it's not dramatic, but we're seeing this. Oh, I think here it is. So we're seeing this blue line. It did go up. I don't know what the difference is here. I don't think that means it's turning down. This is the state line throughout the state. It's a gradual increase. We definitely, toward the end of July, saw a significant increase and expect to see more in the next month for a lot of reasons, both because the mandates for vaccines, but also people understanding the critical situation we're in and needing to get more people vaccinated. We, again, we have the product. It's available. If we don't have it right now, we can get it. There's not a shortage, and so those people who are eligible, we really want them to come in and get their vaccines. But we are seeing an increase now.
Thank you, Alicia. Next up is going to be Danoa.
All right, my question, so many, but let me give you one. Everything that you just discussed with Juan Orozco there about public events, and you're saying that people should give themselves distance. There should be that 12 feet if it's on a stage, or people shouldn't be singing, the mask, and so on. I mean, that just seems like the opposite that we're seeing at concerts in the park. So a lot of people have expressed concerns. Concerts in the Park is coming this Sunday. Somebody had said, I forget now, that there was possibly vaccines being administered there. Could there possibly be some testing options there? And had something else on that. I just went out of my brain. I'm sorry.
So yeah, so we do have a gazebo with testing and vaccines available there every Sunday, and we're very happy that that's been provided for us, and we staff that. Um, the organizers of the event have been. We had a meeting together a few days ago, and they came up with some other ideas, especially during around the concessions, to make sure that people are fully masked and to try and encourage them to maintain their distances. And the same thing is true, in the listening part of the park. They were planning to make some changes in where the speakers were to try and get a little bit more spread out of the crowd. And they were considering some changes in terms of the dance floor as well. And they'll also be making some announcements. But this is not a time when we're legislating and giving firm orders like we did earlier. And I'll just say one of the reasons for that is because of the backlash. We're afraid that if I think, I wouldn't say afraid, but we believe that if we make a lot more orders and restrict people's movements and lives, there's a lot more breaking out of that, of that behavior. And we want to encourage people themselves individually and as families to be as cautious as possible.
Sorry, I just want to add to that. Thank you. That was very informative. Really quickly, are any of the numbers recently that 95 in one day, being that it's 2 weeks now, related to concerts?
It's hard to say that, when we saw some bumps after July 4th, we say, okay, that's the July 4th weekend, but we're beyond that right now, and it's continuing to go up. So I can't attribute it to a specific activity. We saw a little bit of increased numbers also, possibly attributed to Frontier Days, but it was not dramatic. And so I can't say, that we're having outbreaks for this or outbreaks for that. It really is community spread. It's people, giving it to their spouses or their children or vice versa. And it's happening within families. And then again, the other route of spread is people going into work in service industries, servers, food servers, or salespeople, and they don't know they're sick, or they have such minimal symptoms. They say, well, it's just allergies, or the smoke or whatever. And we really want people to understand they need to consider those minimal symptoms COVID unless proven otherwise.
Thank you. Next up is Matt.
Okay, thanks for taking a second round here. So I'm thinking about the winter surge versus the current surge. I'm wondering just to compare and contrast about the dynamics that contributed to last winter surge versus this one. And I'm thinking about what led to the recession of last winter surge and what lessons we learned from the recession of winter surge that we can apply to this one we're going through right now.
That's a good question. And it's a difficult question to answer. What we had last year that we do not have this year is vaccines. And we played that card as hard as we could until we got to people who said, well, they didn't have the time, they were not interested, they were afraid, some resisted, who were, a minority who are just against the vaccines. And so we can revisit that. And what we're trying to do now is really, now that we're so convinced about the safety of the vaccine, saying, look, in these areas, these people who are coming in contact with our most vulnerable people in the community, in the healthcare working field, and also the teachers and so on and so forth, that they should be vaccinated. So we're making it a little bit more. We're encouraging and mandating people more to get vaccinated. That is our main card. And then the other thing are the non-pharmacologic interventions, reminding people that those work. Those really did help us last year, and they will again this year, but we have to do it religiously and not just, say, oh, it's not going to really help us. It does. Those are, for all the respiratory diseases. Look, last year we had almost no flu, and that was because of masks. It wasn't because of, huge increases in vaccinations or the efficacy of those vaccines. And we know that masks really do work, and the distancing works, and the hand hygiene works. All these things taken together, we can't just let the vaccines eclipse the efficacy of all the things that we do ourselves individually in our personal lives. That's taking personal responsibility.
Thanks, Doc.
Thank you, Matt. Next up is Juan.
Hi, thank you. Yeah, I know that it's really good and helpful to see videos and articles of people, social media of a change of heart, a change of opinion in terms of vaccinations, and but I'm curious, as in our county, have we seen any of that change in attitude towards, from the people that have been getting really ill and end up hospitalized, of course, and do we see, or do we still have that reluctance even from people? I mean, from people that have gotten really ill and still not, not giving in.
Yeah, no, I think at this point, what I can say is we've definitely heard anecdotal evidence that people say, well, I saw so-and-so get really sick, I'm getting my shot. Or now I feel like it's, much more accepted, I'm going to get my shot. It's kind of interesting. We had a story of someone who got vaccinated, and they didn't want anybody else to know they were vaccinated because there's still peer pressure in certain groups not to get it. But I think little by little, people are realizing, hey, I was afraid of the effect of vaccination on pregnancy. Now I'm hearing everybody say you should get vaccinated if you're pregnant or you're intending to get pregnant. So that information is getting out there. Unfortunately, we have people in silos, and they have their social media groups, and the messages, the negative messages, just resound. But I think people are seeing in their own lives others who are sick and were not vaccinated, and how sick they got, and even young people who are sick. We had somebody who was in his 20s and was in the ICU, and it's just horrible to see that. So I think if people understand that, they will be changing, and they are changing. It's just happening not dramatically in the way that we like to see it on a graph, but we're seeing it as we see that rise. I think that is happening.
Great. Thank you, Doctor.
Thank you, Juan. Last up, Kate.
Hi. I guess I wanted to just clarify really quickly, and for people that are trying to reach services, they would, if they wanted a place to quarantine, they would contact the county call center. Is that correct?
Absolutely.
Okay. So my question is sort of more of a big picture one. There's been a lot of talk about how the Delta variation is different, and maybe we should even be understanding it as a new virus. Clearly the Delta variant is maybe not the only variant that we're going to see, and this pandemic may be ongoing and evolving moving forward. And so this is sort of what we know right now about this strain. But I was wondering if there's sort of any kind of general guidance that you would like to share with people around, what to anticipate or prepare for over the coming months, as we adjust to the Delta variant, but potentially other variants that might be out there given just the rate of vaccine distribution globally.
Yeah, that's a good question. So the more this virus rages, and we see, these numbers in our contact investigation, contact tracing, you have to understand that it's a lot more people who are getting ill, and this virus has a chance to multiply. And every time it multiplies, there's a chance for another variant to emerge that's stronger than the last. At this point, there have been some other variants we've heard about, but they have been totally eclipsed by the Delta variant, the original Delta variant. So you're hearing Delta Plus. That has not so far turned out to be a large number of cases when they've done the whole genome sequencing. We were worried that it would be, and we're still worried that something like that could emerge. A big concern is that what could emerge is a variant that really is escaping the efficacy of the vaccine. That would be very terrible. And we're hoping that the research that's being done at the present time is actually targeting, the first set of vaccines have targeted this spike protein on the surface of the viruses that attaches to the cells and allows the nuclear material to be injected and do its damage in the cells. And the key with the Delta variant is that you could call it the stickiness of that spike is greater. It just invades and injects the nuclear material much more efficiently. But it may be, and so that's what the vaccines have been targeting, is the proteins on that spike protein. But it may be that there are other ways to target that virus that will be more effective, not only for one variant, but for multiple variants going forward. And so that's how these antiviral agents, these vaccines and so forth, develop. They're not just the perfect one out of the box. And unfortunately, COVID and the Delta variant have really brought, I would say, society to our knees. And this can happen as the Delta variant happened, not necessarily within the United States, which is relatively well vaccinated compared to the rest of the world. Look at where it happened. It happened, we think, in India, where there was a huge surge. It just whipped through that country. And then it went throughout the world. Well, there are places elsewhere in the world that are very poorly vaccinated, 2%, 10%. And so the Delta variant is whipping through there, and there's much more of a possibility of variants emerging. Even within the United States, there are huge disparities between states like ours that have good vaccine uptake and states where it's really not being pushed out by their public health departments, or it's been poo-pooed by other people who have undermined the response to this virus. The same thing with masks. So every time this virus jumps and multiplies, there's a possibility for emergence of another variant. And hopefully the technology will keep up with that. And also our behaviors need to change. So we accept the importance and the efficacy of masking. Masks are really an extraordinarily simple, cheap. Maybe that's why they're not accepted as much in our society, but they're inexpensive and available, and they're very effective. So looking more forward than that, I'm not going to speculate.
Well, thanks for sharing that perspective.
Thank you, Kate. And that sums up today's COVID-19 update. Thank you for joining us. I'd like to give Dr. Coren an opportunity to give his concluding statements if he'd like.
Well, I'll just say, as you know and you've heard, we're at a very different stage in this pandemic than we were just a few months ago or even a couple of weeks ago. And we've got a new situation on our hands, but we have some old tools that we have to dust off and really make use of and respect and get them out there as much as they can. First of all is the vaccines. They are extremely effective and they are extremely safe, and we should be using them, even though there are concerns about needing boosters or concerns about breakthrough. They're nowhere approaching a level where the vaccine has lost its efficacy. And secondly, the non-pharmacologic, the personal things that we can do in terms of wearing a mask, keeping our distances, washing our hands, and other forms of hygiene, those are very important. And even when we talk about masks, we've now learned that double masking would not be a bad thing, would be a useful thing for people who are immune compromised or live with immune compromised people. And also expanding the masking, if you can, to outdoors and crowded spaces. We had lots of laws and rules about gatherings in the past. People have learned them. They hated them. They need to use them as good sense in creating their own parties and gatherings now to keep that vaccine down within our communities. And I think we can do that. I think we've learned as a community. It's a slow process, but I think that will win the day eventually if we pull together and the vaccines are taken up better. So that's all I will say to conclude this session.
Thank you, Dr. Coren.
Mm-hmm.
Thank you, Dr. Coren. Our next update will be scheduled for August 20th. Please continue to follow Mendocino County Public Health on Facebook for all COVID-related updates. Thank you, everyone, for joining us, and enjoy your weekend.